Hello, thank you for being here today. My name is Tara Blasio. I'm the Director of Professional Education for the Alzheimer's Association's Rochester and Finger Lakes Region Chapter. The title of today's webinar is Transformative Diagnosis, Care and Support for Individuals with IDD Living with Dementia. In our time today, my hope is that this presentation will highlight the current state and emerging programs in New York State for individuals living with Alzheimer's dementia and an intellectual developmental disability. Today, you may hear me refer to that as IDD/D. Alzheimer's is a global health problem with more than 6 million people living with the disease in the U.S. alone. The Alzheimer's Association is a global leader in research, mobilizing the field to advance the vision of a world without Alzheimer's and all other dementia. The population of older adults continues to grow, and people with intellectual and developmental disabilities, or IDD, are experiencing an unprecedented increase in longevity and consequently facing more age-related challenges, including the development of dementia. This increase presents several public health challenges that we in New York State are positioned to address. The Alzheimer's Association provides programs and services that promote and support aging in place to those with IDD/D. These programs support aging with dignity and grace, and because of the association's services, provide an opportunity for people to age in place. The various services encourage and enhance meaningful relationships for people with IDD with their friends, family members, others in their lives by providing them with information, referral, care consultation, social engagement opportunities, creative programs, and educational programs that will enhance the quality of life of the person living with Alzheimer's. The presentation will also highlight that there are limited training and health system supports for professional and family caregivers of people with IDD as they develop and live with dementia. Gaps and barriers in the healthcare system cause individuals with IDD to regularly experience delayed diagnosis, misdiagnosis, delayed treatment, and lower quality care. New York State, in partnership with local community-based organizations, is leading the charge to address this issue, and I am looking forward to sharing those experiences with all of you today. I would also like to share with you the very basic facts about Alzheimer's disease and also discuss briefly strategies to engage with people with IDD, utilizing person-centered approaches to care and support and using dementia care techniques in line with the nationally recognized Alzheimer's Association Dementia Care Practice Recommendation. These are in 5 key topic areas: detection and diagnosis, assessment and care planning, dementia-related behaviors and communication, supportive and therapeutic environment, and activities of daily living. Let's start with an introduction to our organization, the Alzheimer's Association. If you are not familiar with the Alzheimer's Association, we are a worldwide voluntary health organization dedicated to Alzheimer's care, support, and research. Our mission is threefold. We are leading the way to end Alzheimer's and all other dementia by accelerating global research. We are the largest nonprofit funder of research in the world. We are driving risk reduction and early detection, and what we're learning about risk reduction is very exciting. And we are maximizing quality care and support through the services that we deliver and how we support others working in the community as well. Incidentally, I'd like to point out to you here on the left side of the slide, this symbol that you often see from the Alzheimer's Association, which represents our commitment to people and to brain health on the left, and there to science on the right with the image of a beaker. I'd like to spend a couple minutes just talking more about 3 very important pillars of the Alzheimer's Association. The first being care and support. The Alzheimer's Association works on a national and local level to provide care and support for all people affected by Alzheimer's and other dementia, and we are doing that nationally in all communities. Research. As the largest nonprofit funder of Alzheimer's research, the association is committed to advancing vital research toward methods of treatment, prevention, and ultimately a cure. Also, advocacy. The Alzheimer's Association is the leading voice for Alzheimer's disease advocacy, fighting for critical Alzheimer's research and care initiatives at the state and federal level. Currently, I'd like to share some statistical information with you. Every year, the Alzheimer's Association releases the Alzheimer's Association Disease Facts and Figures. You can learn more about the Alzheimer's Association facts and figures at alz.org/facts. I would like to share with you today that nearly 7 million Americans are living with Alzheimer's. Alzheimer's disease kills more than breast cancer and prostate cancer combined. And we know that 1 in 3 seniors dies with Alzheimer's or another dementia. At this time, I would like to talk with you about some statistical information in our state, New York State. You can see that we have about 426,500 people living with Alzheimer's across the state right now. Between now and 2025, we're anticipating approximately a 12% increase in cases, putting us at about 460,000. Let's talk for a minute about caregiver health. 59% of caregivers report living with other chronic health conditions. 24.7% caregivers report experiencing depression. And 12% of our caregivers are reporting being in poor physical health. Looking at these statistics, you can see that we are spending a great deal of money as a state caring for our caregivers. Also alarming are workforce statistics. We know we're already in a workforce crisis with most parts of the country not having enough direct care workers. With the projected increase in Alzheimer's disease cases, we would need 44% more geriatricians and 60% more home health and personal aides to meet the demands. And unfortunately, it's a time that people are not choosing to enter this type of work. So it's more critical than ever that we really tap into the resources that we do have, work creatively within our networks to get people the support they need. As an educator, one of the most common questions that I get when I'm out teaching in the community, as do my association colleagues, is what is the difference between Alzheimer's disease and dementia? So let's talk about some definitions. Many people use the terms dementia and Alzheimer's interchangeably. The truth is there are some significant differences we should highlight. When we hear the word dementia, we need to remember that it's not a true diagnosis in its end form. Really, dementia is a collection of symptoms related to cognitive decline. We know what the symptoms of dementia are: problems with thinking, reasoning, judgment, memory, behavior. Those symptoms are due to biological changes in the brain that are occurring. What we need to know is what the condition is that's actually causing those symptoms of dementia. So dementia is really an umbrella term, and you'll see here on this slide the image of an umbrella. It's an umbrella term, and under that umbrella are all the different types of dementia. Alzheimer's disease is the most common, accounting for about 60 to 80% of cases. Other common types of dementia are vascular dementia, frontotemporal dementia, and Lewy body dementia. Mixed dementia is also common. That's when we see Alzheimer's disease plus another kind of dementia coexisting. We do know that some causes of cognitive decline are treatable. Some, although like Alzheimer's, are progressive and irreversible. I'm going to talk with you next about Alzheimer's disease as a continuum. We mean that changes are happening over time. The first stage here in green is the asymptomatic stage. That means that an individual has no cognitive symptoms, but some of those biological changes are beginning to happen in the brain. So we see no outward signs with this person that there are biological changes happening in the brain. They are not showing any outward signs of cognitive decline. But we do know that those changes, the buildup of amyloid beta plaques and tau tangles, can begin up to 20 years before the first symptom appears. As we move through the continuum, symptoms of cognitive decline begin to appear as the brain changes continue and their brain begins to experience some cell death. For the purpose of the slide, the initial symptoms that we're referring to is mild cognitive impairment, also known as MCI. MCI due to Alzheimer's disease. MCI means someone is living with the early stages of cognitive loss. It doesn't affect most of their daily activities, but noticeable changes do exist. Everyone who experiences dementia will have passed through a stage of MCI, but not everyone who has MCI has it due to Alzheimer's disease. When we say MCI due to Alzheimer's, it means that they have those underlying brain changes, the amyloid plaques or tau tangles in the brain. But you can also have MCI for other reasons, possibly potential side effects from medication or vascular disease. I want to emphasize again that not everyone who has MCI goes on to develop dementia. However, those who do have MCI are at a higher risk of developing dementia in the future. So it's so important to define what the cause of mild cognitive impairment is. Understanding what is causing the changes at the earliest stages of disease will be important for making sure that people are on the right treatment path. This provides an opportunity for treatment and potential prevention. If we can prevent new cases of MCI, we may be able to prevent new cases of dementia. So early communication between doctors and patients is key because the disease doesn't happen overnight, and it's so important to detect it early. There, moving into the lavender and the purple, you will see the 3 stages of dementia due to Alzheimer's disease, sometimes referred to as early, middle, and late stage disease. For the purposes of this slide, mild, moderate, and severe stage disease. People living in mild stage disease have some interference with some daily activities. And then moving through moderate stage disease, many daily activities are impacted. And when people are living in severe stage dementia due to Alzheimer's disease, most or all of their daily activities are impacted. Okay, moving right along, I'd like to talk with you about the warning signs of Alzheimer's disease. And when myself and my association colleagues are out in the community or tabling at a local health fair, one of the things that people often ask us is how do they know the difference between what might be some normal age-related changes in their thinking versus a warning sign of Alzheimer's disease? And so the Alzheimer's Association has identified these 10 warning signs of Alzheimer's. If you or someone you know is experiencing any of these warning signs, it's time to have a conversation with the doctor. They can be an indication that there is something else going on that is not considered to be normal with age-related changes in your thinking. So let's go through these 10 signs together. Sign number 1 is memory loss that disrupts daily life. Number 2, challenges in planning or solving. 3 is difficulty completing familiar tasks. So for example, if someone has always been able to find their local hardware store and they begin to have trouble driving or navigating to a place that they were very familiar with, it can be a warning sign. Or if they have a recipe for a famous blueberry pie that they've always made and all of a sudden they start to develop trouble with creating that recipe. So a familiar task becomes more challenging. Number 4, confusion with time or place. Number 5, a warning sign of Alzheimer's disease can be trouble understanding visual images and spatial relationships. Sometimes when people are in the earlier stages, they may have a small vehicular accident or a fender bender due to having difficulty judging those spatial relationships. Number 6, new problem with words that can be in speaking or in writing. Number 7, misplacing things and losing the ability to retrace. We all lose things. I'm willing to bet that most of us misplace our phones at least 3 or 4 times a day. The difference is when we lose our phone, we are able to retrace our steps and go back in our minds and think about the steps that we took and then hopefully recover the item that we have lost. A warning sign is misplacing things and then losing the ability to retrace those steps. Number 8, decreased or poor judgment. Number 9, we see withdrawal from work or social activities. Number 10, changes in mood and personality. So I wanted to be sure to share those with you. There is more information available on our website at alz.org backslash 10 signs. I want to talk with you for a minute about some gaps and barriers in our health system. We're facing a challenging time where there's gaps and barriers in our health system that leads to individuals with IDD living with dementia to regularly experience delayed diagnosis of dementia or misdiagnosis. It could be also delayed treatment and lower quality care. Alzheimer's and other dementia present particular challenges for people with intellectual developmental disabilities. As we discussed earlier, there's an unprecedented increase in longevity, and consequently, people are facing more age-related challenges, and that does include the development of dementia. As we know, also, there are limited training and health system supports for professional and family caregivers of people with IDD as they develop and live with dementia. So for individuals with IDD and dementia, they will experience some general symptoms. Those can be things like disorientation, memory loss, confusion. The symptoms may be a bit harder to recognize depending on the person's level of functioning. But I'd like to share with you some signs of dementia in those with IDD. We will often see additional signs and symptoms in people with IDD who are developing dementia. Some of these may include gait deterioration. People may have increased problems with balance. They may have shuffling feet when walking, issues or concerns with transitions while walking, such as using stairs or stepping up on curbs. We may also see late onset of seizures. Please be aware that seizures do not typically occur in the general population, but they are more common in people with IDD. There may be significant weight loss, speech deterioration, a change in sleep pattern. So circadian rhythm may change, and you may see people sleeping during the day and awake at night. An additional sign could be increased irritability and apathy. When working with a person with IDD, it is important that you know the person well so that you will be able to recognize if the person is exhibiting any of these signs and symptoms. If the person is exhibiting these signs and symptoms, they should be referred to a medical practitioner specialist as soon as these changes are noticed. I want to talk with you a little more about the connection between dementia and IDD. As people with intellectual and developmental disabilities age, they may be at risk for developing dementia. And due to a unique genetic connection, people with Down syndrome have a 90% lifetime risk of developing Alzheimer's disease. Advances in medical care have significantly extended the average life expectancy of people with Down syndrome to age 60. This has led to people developing additional health risks. People with Down syndrome experience accelerated aging and tend to experience age-related health concerns, including dementia, approximately 15 to 20 years earlier than adults in the general population. Typically, adults with Down syndrome are in their late 40s or early 50s when the symptoms of Alzheimer's disease first appear. According to the National Down Syndrome Society's publication on Alzheimer's disease and Down syndrome, Alzheimer's disease and Down syndrome share a unique connection. In the typical population, people have 2 copies of each chromosome. Individuals with Down syndrome have an extra copy of chromosome 21. Chromosome 21 carries a gene for the protein that is produced in excess in Alzheimer's disease. This protein is responsible for forming the plaques that cause permanent damage to brain cells. Because individuals with Down syndrome carry 3 copies of chromosome 21, they have an overproduction of beta amyloid. These unique properties of chromosome 21 are associated with the elevated risk of premature Alzheimer's disease for individuals with Down syndrome. Just like to call your attention to the slide again for the connection between dementia and IDD. Risk increases for those over the age of 40 with Down syndrome, someone at over the age of 59 that has an intellectual disability of another cause. Also, if the individual has some form of head injury or TBI, especially if it's severe or there's multiple head injuries. There's also an increased risk if the individual has a family history of Alzheimer's disease. Alzheimer's and the complications from Alzheimer's disease are the leading cause of death in adults with Down syndrome. Okay, at this point in the presentation, we're going to change gears a little bit. I would like to talk with you about the fundamentals of person-centered care. Person-centered care is a philosophy of care that focuses on the individual living with dementia. It emphasizes that a person is not their diagnosis. We are all unique individuals with unique life stories, unique likes and preferences, and unique histories. And so the most important thing when you are working with someone is knowing the person. Best care practices are guided by the individual and who they are. Dignity, respect, and authenticity are central to care and relationship with all individuals. The social environment should include opportunities for engagement that are meaningful. Meaningful based on the interests and preferences of the people that we are taking care of. There is no one size fits all to dementia care. And if you could see on the right side of the slide, our person-centered focus wheel there. In the middle of the wheel is the person-centered focus in purple. And then all along the spokes of the wheel are all the different areas that we can apply the person-centered philosophy to, whether it's diagnosis, whether it's managing medications, doing care planning, addressing any dementia-related behaviors. All of these entities can be managed through a person-centered focus lens. So as we talked about at the outset of today's webinar, we can apply a person-centered approach in many areas. We're going to focus on these 5 areas for today: detection and diagnosis, assessment and care planning, dementia-related behaviors and communication, supportive and therapeutic environment, and supporting activities of daily living. When we are thinking about all areas of care, we want to always recognize functional and cognitive ability. We really want to think about and appreciate individual preferences and identity. Consider dignity, respect, and choice in all areas. Most important to think about dignity, respect, and choice in some of those more sensitive areas, such as those activities of daily living, like toileting and eating. We always want to put the person before the task. We can do that by focusing on these three areas: dignity, respect, and choice. So let's talk and let's start with detection and diagnosis. There are various strategies that may be used to document and track baseline abilities over time, but a structured and comprehensive approach is recommended to capture abilities in a range of skills. The National Task Group on Intellectual Disabilities and Dementia Early Detection Screen for Dementia is a useful tool to record observations and changes in functioning in adults with IDD. This instrument was designed specifically for use by family caregivers and agencies to identify early signs and symptoms of dementia. It is important to note that this screening tool is not used to diagnose dementia, but it can identify specific areas of change that can further direct discussion and evaluation with a healthcare provider. And there on the screen, you'll see at the bottom of the slide is the link and the website to access this tool. So diagnosis and detection in the IDD population can be more challenging. Why is this? Well, detection of dementia symptoms may be more subtle and difficult with someone who has a lifelong impairment. The initial or most prominent symptoms may differ from the general population. The individual may not be able to report their symptoms. And so we must rely on family and support staff for reports. We'll introduce you to an important tool that can help with this process in the resources section at the end of this presentation. For individuals with IDD, the typical diagnostic evaluations may not be effective or appropriate. Conditions associated with IDD may be mistaken for dementia or dementia symptoms. Dementia, may be mistaken for dementia, or dementia symptoms may be mistaken for psychiatric conditions. As with the general population, there is no single diagnostic test for Alzheimer's disease or dementia. If dementia is suspected, a complete physical exam and more frequent medical, neurological, and psychological evaluations are needed to establish the progressive nature of the symptoms and rule out other causes. Let's talk about some general guidelines for diagnosis. Most people address concerns about memory, thinking, and behavior with their primary care physicians first. In some cases, the primary care physician may refer the person to a specialist for further evaluation. To diagnose Alzheimer's, various assessments and tests may be used. These assessments may include a medical history, physical exam, screening for depression, and interviews with family and support staff. Some of the tests that may be done include laboratory tests, mental cognitive status tests, brain imaging, vision tests, hearing tests, and sleep studies. It is also very important to rule out other causes that may be impacting a person's memory and behavior. These include thyroid conditions, depression, sleep apnea, uncontrolled blood pressure, medication side effects, and hearing loss. Moving on to assessment and care planning. According to the Alzheimer's Association Dementia Care recommendations, there's some things that we should know about assessment and care planning. Assessment should identify challenges to health, functioning, and quality of life, as well as the opportunities to optimize these areas and support individuality. Care planning should occur every 6 months or after changes are noted, changes in needs or abilities. Care planning needs to be centered, person-centered, and address the whole person. Assessment and especially care planning goals should always support the best possible life for the person living with dementia and family, including advanced planning. At this time, we're going to shift gears a little bit and we're going to talk about dementia-related behaviors and communication. First, I just want to chat with you about cognitive changes in general. So we know that living with cognitive changes or living with dementia, we see more than the memory loss piece. There is definitely memory loss. We know that that short-term memory is impacted, but there are other areas of cognitive change that I'd like to talk with you about. And so if you see this image on the slide with the different bubbles, so someone living with cognitive change is possibly going to experience difficulty with planning, initiating. We may invite this person to participate in a social activity, and they may be struggling with the impetus and motivation to attend. So initiating, attending an activity. Short-term memory is impacted by cognitive change. Oftentimes, folks are able to retain long-term memory fairly well, but short-term memory dissipates more and more as the disease progresses. Cognitive changes can also affect judgment. So there's changes in judgment. Logic and rational thinking is impacted. And we do see impulse control affected with cognitive changes. And we're going to talk a little bit about that related to dementia-related behaviors in just a moment. So there is a relationship between dementia-related behaviors and communication. So what are our goals when we're communicating? We want to be giving information. We want to be expressing emotion to someone. We want to be forming a connection with other people. So with dementia, there will be some changes in communication, maybe the way our communication is expressed, maybe the comprehension of that communication. The dynamics of the exchange in communication may change, and the balance transfer may change. So there may be a different dynamic with the transfer of information back and forth with communication. One of the key things to keep in mind when we're talking about dementia-related behaviors and communication as professionals and family caregivers, we need to think about what needs to change, and that is our expectations and our approach. So there are things that we can do in our own thoughts and in our own perceptions about dementia and behaviors, as well as in the way that we approach others. I'm going to spend a few minutes taking you through this list of communication tips. And I think that this will really lend itself to a good conversation about the relationship between communication and behaviors. So the communication skills of a person living with Alzheimer's will gradually decline as the disease progresses. Eventually, the person will have more and more difficulty expressing their thoughts and emotions. Challenges associated with communication can definitely lead to frustration. For individuals living with Alzheimer's, changes in communication vary depending on the person and how far along he or she has progressed in the disease. Let's talk about the tips that may help for more successful communication. Try to be patient, supportive, and offer reassurance. Try to engage the person one-on-one in a quiet space with minimal distractions. We know that people can become overstimulated easily, and if there's a lot of background noise and a lot of distraction in the environment, it can be frightening or overwhelming. We can alter the way that we ask questions. We can be specific. We would like to try to ask one question at a time. And rather than asking an open-ended question such as, what would you like to drink? We can ask, would you like some coffee or tea? Try to give the person plenty of time to respond. Sometimes people are really close with coming up with the answer. They just need a few extra moments. Again, try to ask one question at a time. We have to try to not quiz or ask memory-dependent questions. Speak slowly and clearly, not necessarily more loudly, but slowly and clearly, maintaining good eye contact. Try to avoid criticizing or correcting. Do not argue. If the person says something you don't agree with, let it be. Let it go. We never want to engage in an argument with someone living with dementia. Written notes and photographs and pictures are great cues for communication. So using some written communication or including some pictures and photographs while trying to communicate can be very helpful. I know I learned from a support group member a great tip once about using photographs. Instead of printing generic photographs off the internet as a caregiver or professional caregiver, take photographs of the person's actual personal items. So their cup, their toothbrush, their notebook. And so those things become even more relatable through pictures when they are things that are personal to them. Offer step-by-step instructions. Try to give one instruction at a time. And then sometimes we need to repeat what was said to clarify. So I hope you find those communication tips helpful. I'm sure you will have access to these after the conference today. And I want to thank you for letting me go through them. It's some of my most favorite content to talk about and so effective and important. We're going to talk a little bit about behavior changes with dementia. A person living with Alzheimer's disease or another dementia will eventually struggle to make sense of the world around them. They may not know what is real or what is safe or what behavior is appropriate in a certain situation. Alzheimer's disease causes changes in the brain that may make the person act in a new or unusual way. Some people develop anxiety, or some people become aggressive. Sometimes people repeat certain questions or gestures. While dementia-related behaviors can be challenging, It's important to understand that they are not something the person can control. These behaviors are actually a form of communication. I'd like to repeat that part. Dementia-related behaviors are a form of communication, and it can be helpful to remember that it may be someone's best way or only way of communicating what is going on with them. Here are some dementia-related behaviors and things that may cause them. So anxiety and agitation, a person experiencing anxiety or agitation may seem worried or nervous. They may act short-tempered or have a hard time sitting still. Some things that may lead to anxiety and agitation are moving to a new residence, changes in environment, hospitalization, having visitors, being introduced to new staff or caregiver, or believing that something is a threat, even if it's not. Going along the lines of moving into a new environment or changing in the environment, changes in routine in general can cause anxiety and agitation. Aggressive behavior may be verbal or physical. These can occur suddenly and for no apparent reason, but anger and aggression may be the result of physical discomfort, something like pain or hunger. It could be an environmental factor like a noisy room. Anger and aggression may be the result of frustration due to limitations in communication and poor understanding. Wandering. It's common for a person living with dementia to wander or become lost or confused about their location. 6 out of 10 people living with dementia will wander. Some of the reasons that someone may wander is they have a physical need, they're in pain, they're feeling restless, they have an unmet need, they're hungry or thirsty. It could be that they're bored. Suspicions and delusions, confusion and memory loss, such as the inability to remember certain people or objects, can contribute to untrue beliefs. For example, the person may think that people are stealing from them. Some situations that can lead to suspicion are the person discovers that their wallet is empty, or they may forget that an item was moved from one place to another, and that can cause them to be suspicious. Sometimes it can be hard to figure out what's causing a person's dementia-related behavior. So I'd like to introduce you to a 4-step person-centered approach. It can help you recognize a trigger and respond appropriately. The first step is detect and connect. So knowing the person, using that person-centered approach, use what you know about the person to try and understand their needs and feelings. So you're playing detective in this part, thinking about what you know about them, thinking about what you know about their likes and dislikes. Also, acceptance. Accept that what the person believes in that moment to be true, even if it isn't true. Try to see the world through their eyes. The next step in this approach is to take care of any physical needs. Always check for physical pain first. Somebody may have pain from an injury or a recent fall. There may be medical issues such as a urinary tract infection or possible medication side effects. Sometimes pain can be caused from uncomfortable clothing. Maybe clothes are too tight or pinching someone. It could be a lighting issue. There could be glare. The room temperature, it could be too hot or too cold. Again, there may be hunger or thirst or the need to want to get up and move around. Another physical need could be the need to use the bathroom. It simply could be that there's too much noise or activity. The third step in the person-centered approach is focus on emotional needs. Think about how the person might be feeling and ask yourself what emotion they may be experiencing. Again, use your knowledge of the person and their likes and dislikes to redirect them to a different activity. It's always helpful to validate what somebody is feeling. If they're feeling frightened, to say, I know you're feeling frightened. Let's go take a walk outside for a little while and redirect them to something more pleasant. Step 4, review and plan for next time. Think about what worked and didn't work. What would you do differently in the future? This type of behavior may happen again, so it's important to ask, what were some of the warning signs before the behavior? What worked well? How can you tell if your approach worked? And who else may be able to help if needed? Remember that changes in the brain can lead to changes in the senses and perceptions, as well as memory and orientation. This may make the experience of someone living with dementia different from what we experience. We need to accept their reality because what they are feeling is real to them. Their reality is as real to them as ours is to us. Let's talk about some tips for creating a person-centered environment. How can we make the environment more supportive and therapeutic? Oftentimes in group homes, we see some changes to the physical environment with safety measures, things like regulated water temperature, door chimes, grab bars in bathrooms, and secure medication storage. There are some things that we can do to increase the safety in the environment, such as keeping all cleaning products like liquid laundry packs and bleach out of sight or secured to avoid possible ingestion. Removing tripping hazards like rugs, extension cords, or clutter. Securing large furniture like bookshelves and cabinets to prevent tipping. Ensure chairs have armrests to provide support when going from sitting to standing. Applying stickers to glass doors to make sure they're visible, using textured stickers on slippery surfaces to prevent falls, providing seating near the bed to help with dressing, and try to ensure the closet shelves are at an accessible height so that items are easy to reach. So these are just some examples, and there's some additional examples on this slide to creating a supportive and therapeutic and safe environment. Some things to keep in mind for daily care routine. What are some person-centered tips for daily care? Daily routines can be helpful for a person living with Alzheimer's. Try to create a fairly predictable daily schedule to help reduce feelings of anxiety and fear as dementia progresses. Daily activities may take much longer, and planning for this can reduce stress for the individual and for the support staff. Consider creating a memory center, which could include a calendar, a list of phone numbers, and photographs that may help the person with dementia by providing some visual cues. When providing support, resist the urge to do the entire task for the person. Allow them to maintain their independence and the abilities that they do have as long as possible. A person with Alzheimer's will eventually need a caregiver's assistance to organize their day. Structured and pleasant activities can often reduce agitation and improve mood. Planning activities for a person with dementia works best when you continually explore, experiment, and adjust. So we want to be sure that we are creating a daily plan. Sometimes we need to use gestures with activities of daily living and that daily care. If we want to encourage someone to brush their teeth, we may need to gesture to assist someone with brushing their teeth. Always be reassuring, provide praise, and definitely incorporating choice whenever possible. Choice and autonomy included in the daily care routine whenever that is possible are key. So here in New York State at the Alzheimer's Association, we are very fortunate to have a collaborative entity known as the New York State Coalition. It is a coalition that is comprised of the 7 chapters of the Alzheimer's Association New York State, provides a ton of wonderful programs and education and resources. And I wanted to share with you what the names of the 7 chapters of New York State are. So there's a Rochester and Finger Lakes Region chapter, which is the chapter that I'm located at, Central New York, Northeastern New York, Hudson Valley, Long Island, New York City, and Western New York. And we do things individually as chapters sometimes based on the regions that we cover and the different communities that we work with. But oftentimes we do things collaboratively as a state, as a coalition. We have many, many wonderful statewide programs and services for our constituents as well. So our chapters offer care and support services in all 62 counties across New York State. We have a menu of core services that each of these chapters provides. So for those of you who don't know, the Alzheimer's Association has a 24/7 free helpline. The phone number is 800-272-3900. It is a 24-hour, 365-day-a-year service. You'll always get a live person when calling into the Alzheimer's Association helpline. And there are people there available to answer a question if you're living with dementia or you know someone who is, or if you simply want to learn more and you have a question about Alzheimer's disease and dementia. That 24/7 helpline is always available. And there is a chat feature through the helpline available most days between 9 and 9 as well if you need to have a more discreet conversation. But please use that service. It is available always. Care consultations are meetings that take place in the community or sometimes at our office. During care consultations, dementia care experts are meeting with someone living with dementia or someone living with dementia and a family member or a spouse. They could be the dementia expert one-on-one meeting with someone. They could be the dementia expert meeting with an entire family for a family care consultation. It is a free and confidential caring conversation with a dementia care expert. We will talk about things like driving, legal and financial consideration, different levels of care, and help a family put a plan together for the future. In addition, we will make sure that they know about all the programs and services that are available in their community and help them register for the things that are most helpful to them. The Alzheimer's Association provides free caregiver education. That's to family caregivers and professionals as well. These are offered at community locations on a variety of topics. Some are understanding Alzheimer's and dementia, legal and financial planning. We have different series where we talk about the different stages of Alzheimer's disease. And again, we do have a number of education targeted at our workforce for professional education in all of the communities that we serve as well. Our support groups are, whoops, I moved a little too quickly there. Sorry. Going back one. There we go. Oh, my first glitch in the slides. So our support groups are available to caregivers. They are a confidential, safe place to come together with other caregivers, get support, get some tips, share ideas, share information about things that you've learned about what's available in your community. Most importantly, to meet people and learn from other people and develop some social support as a caregiver. Many of our caregivers become friends with people they meet in support groups and they lean on each other in between the support group meetings by text, by phone, by meeting for meals. So it is a way to connect with other people in your community and get some support. And those groups are all held and led by either an Alzheimer's Association staff member or a trained volunteer. There are many, many support groups that are held in person, and we have retained many virtual support group options for people as well. Lastly, our early stage, and I did it again, trigger finger today. Lastly, our early stage social engagement activities. These are activities that are happening out in the community, things such as the orchestra or the ballet or an art class. They are for people that are living in the early stages and a care partner. So it could be their spouse, it could be a caregiver, could be a neighbor or a friend. So they attend these social activities in the community and they get to know and meet other people who are walking this Alzheimer's or dementia journey as well. So I'll share with you in a few minutes how to find out about what early stage engagement activities are happening near you. So I want to touch on some of the Alzheimer's Association care and support that's available nationally. So we talked about that 24/7 helpline. We do have master's level clinicians available to speak with people who need a care consultation over the phone. And the support is available in over 200 languages. Our website, which is alz.org, is quite robust. There's information in there for people. They often will go there for the first time after receiving a diagnosis, but there's information and educational opportunities for people living with the disease, caregivers, and healthcare professionals as well. ALZ Connected is a free online community designed for people living with dementia and their caregivers. I like to think of it as an ongoing chat forum where people can join an ongoing support group, pose a question, put a question out there, and engage with other people through this platform and lean on each other if that's how you prefer to get support. And that's alz.org/ALZ Connected. So our education and support, we talked about that a little bit. We do have our caregiver education offered either virtually or in person on a whole host of topics. There on the bottom left is our community resource finder. That is a database and a tool that is web-based that we do in partnership with AARP, where you can go in and find out aging related resources in your area. And so these may be if you're looking for a long-term care community or you're looking for a physician, you can do a search based on your zip code. There is information on the Alzheimer's Association programs and services happening near you too. So this is one way to find out what programs are available in your area. You go in, you put in your zip code, and it will populate out the different education support groups and et cetera that are happening in communities near you. Lastly, that alz.org/find us. So this will give you access to the programs and services in communities across the country. So if you are traveling, if you have family living in another part of the country, you can find out about programs and services happening nationally across the country. And of course, you are more than welcome to call the helpline for that information as well. I'm going to talk about a couple of resources that are available specific to IDD and dementia. The Alzheimer's Association website has a really great primer on Down syndrome and Alzheimer's disease, covering prevalences, causes, diagnosis, and research trials. So for that, you would go to Down syndrome and Alzheimer's symptoms and treatments, and that is right on the alz.org website. Also, the National Down Syndrome Society has two excellent resources, and the link for those resources is right here on the slide. The National Task Group on Intellectual Disabilities and Dementia Practices has a screening tool for caregivers and families, and that's there. That's the www.the-ntg.org. And if you're not able to write these links down, don't worry, we've got a solution for that, but these are here on the slide for you. The NTG Family Support Program also provides a twice yearly informative webinar series on dementia and intellectual disabilities, and that link is there. I also want to let you know that the Alzheimer's Association does have a virtual support group for caregivers of people with IDD and Down syndrome and Alzheimer's disease. So if you or someone you know is a caregiver of someone living with IDD and a form of dementia, I would highly recommend this virtual support group. To get more information and register, you can call the helpline phone number 800-272-3900. Also available from the Alzheimer's Association, this program known as the intersection of IDD and Alzheimer's disease. It is a four-part, it's a four-part evergreen webinar series that covers that NTG screening tool, Alzheimer's disease warning signs, communication and behavior, and the 4Ms, mobility, mentation, medications, in what matters. To access one of these or all of these recordings, you can use the link that is provided there. Up next, I want to talk with you a little bit about the Alzheimer's Association professional education and the products available for those who are healthcare workers and professionals. Our Essentials program is an online training and certification based on the Alzheimer's Association's evidence-based dementia care practice recommendation. So it is an online self-paced training that users can go in and get certified and take a test. And that is the Essentials program. I'm going to share a link with you how to access that, as well as give you a way to contact me if you have any questions about these resources after today. The Alzheimer's Association does have a dementia care echo program that connects multidisciplinary dementia care experts with professional care providers in a series of interactive case-based video conferencing sessions. So that echo program is available through our home office for long-term care workers. The Alzheimer's Association has a curriculum review product where leadership from dementia, from long-term care communities can submit their curricula to the experts at the Alzheimer's Association for review. And they will review the existing curricula and orientation training that long-term care communities have in place and make recommendations for them. In addition to that, the Alzheimer's Association offers a host of courses online through their website, CEU, CNE, CME programs and courses are available. And these aren't just for long-term care staff. We have courses available through our website for clinicians, for researchers, and for first responders. So I would encourage you to check out the courses available through the Alzheimer's Association website that are accredited as well. Lastly, the Dementia Care Provider Roundtable. It's a consortium of thought leaders from the dementia care provider industry, including assisted living, nursing home, home and community-based services. And through the Dementia Care Provider Roundtable, the Alzheimer's Association brings together industry leaders to discuss key areas in Alzheimer's care and support practices in a pre-competitive platform. The roundtable meets twice a year in person and also convenes by video conference twice a year for coverage of topics identified by members as the most current critical needs. I also want to let you know that coming down the pike is a care management certification program. And for more information on that or any of these products, you can go to alz.org/professionals/professional providers. I would like to encourage you to connect with your local Alzheimer's Association chapter. Reach out, learn more about the chapter that is in your community and who the staff is and what programs and services they are providing to your area and your communities. Please use us as a resource. We are always looking for different entities, community partners, and organizations to collaborate with. I would highly suggest if you are working in the long-term care industry or community care or home care, looking into the essential certification, curriculum review, or Project Echo. I would be remiss if I didn't share with you that the Alzheimer's Association is always looking to increase our reach across the country. So if you are interested in a volunteer opportunity with the Alzheimer's Association, we would love to talk to you. And you can find out more at alz.org/volunteer. Another way that you can engage with the Alzheimer's Association is by participating in an event. The Alzheimer's Association hosts a number of fundraising events throughout the year to raise those critical funds for research and help us achieve our mission of finding a cure for Alzheimer's and all other forms of dementia. You can learn more about these events, such as the longest stay or walk, the Walk to End Alzheimer's, by visiting alz.org/TLD, which stands for the longest day, or by learning more about the Walk to End Alzheimer's and the walks happening in your community by visiting alz.org/walk. I want to really thank you for attending this webinar today and for being with us to talk about this very important topic of IDD and dementia. I hope that you have learned something at this webinar and that you enjoy the rest of the conference. I did say that I would share my email address with you, and I would really very much like to do that. So if you have questions about today's presentation, my email address is tsblasio, so that's TSBLASIO @alz.org. You can also submit a question through the Whova app. So you can submit your question right through the conference Whova app as well, but more than happy to answer any questions by email since I'm not able to be with you at the conference. I hope that you enjoy the remaining sessions of the conference, and I want to thank you on behalf of the Alzheimer's Association for attending today. And last but not least, I want to wish you a very safe and happy summer. Thank you.